this. We will get through this together. Let's say it one more time. We will get through this. We will get through this together. And we're going to get through this because we're going to follow the 10 steps that help us to defeat the coronavirus. And these 10 steps are so important because you, every single one of you all at home, have the ability to do something about this virus. Every single one of you have control. I'm not going to talk about yesterday. I know there was some noise, but I did read one statement in the newspaper that somebody, do we have that, James? Somebody said that yeah. I'm not going to read that because there are kids watching at home. But that last part of what was said after that quote is, but there's nothing I can do about it. There is something that everybody can do about this coronavirus. It's following those 10 steps. If you stay healthy at home, then you prevent people from dying. If you engage in social distancing, then you can stop people from dying. If you make sure that you follow our 10 rules, and let's put those back up again, James, if we can, that is how we do everything it takes to beat this virus. It is in each and every one of our hands. And that's why I always talk about this being not only the test of our humanity, but for the first time that I can remember, something that every single person has the ability to do something about. And it being our collective actions that are going to help to ultimately save people. So remember, the 10 steps: stay healthy at home, avoid crowds and gatherings, practice social distancing, knowing when to seek care, making sure that you go to reputable sources for news, kycovid19.ky.gov, wash your hands and surfaces. This is really important. Apply for benefits, prioritize your mental health, do not travel, and report non-compliance. So we always talk about those 10 steps and keep it up because we are doing a very good job here in Kentucky. But there is an 11th step. This is going to help us rebuild. Make sure you fill out your census. We increased by 0.5% between yesterday and today, and thank you for that. But we are still in 17th place. I know we can do better than that. Every region of our state, we need a little bit better. Make sure you fill this out tonight. With all the sacrifices you have made to fight this coronavirus, do this very simple thing that is going to help us rebuild. This is part of our battle. It is also your duty as an American, and it's required under the law. So every day we've also asked you to set those positive examples of our sacrifice and of the fact that while we have had to change our lives and to upend them in ways that we never expected, that we know what we're doing is right and it is good, that we are being a good neighbor, that when we follow the rules and the regulations, when we all come together, that we save people's lives. And you know what? We ought to show the rest of the world that. That's why we ask you to fill up social media with Team Kentucky, Together KY, Patriot, and Healthy at Home. And so let's look a little bit about what we have today. All right. This is a thank you to Nancy Pugh, who provided PPE to firefighters here in Kentucky. Thank you to everybody out there that is spending their time trying to take care of other people. When we do this, when we increase our PPE, and tomorrow we're going to have a big discussion on that because it's one of those standards that we're going to have to look at timing of when we can do and open up different things. This really helps. It protects people, and these are first responders. We appreciate you. All right, this is the Grayson County Courthouse. And we've been showing our courthouses now every day for about 3 days just to show you that everywhere, people are lighting up homes and facilities green to honor those that have been lost. Toughest thing that I've ever had to do, not just as governor, but in my life, is to list those that we have lost each and every day. But you know, this gives me comfort, and I know it gives these families comfort. It's a way that each of us can do something small to where families that can't go to a funeral right now, that have to go through grief without having that option, can see that we all care. So thank you, Grayson County, for being on Team Kentucky. All right, here is some of the little clinic workers from Kroger working at that Frankfort site. We're going to have a lot of announcements about this today, but this is a look inside. We appreciate all their hard work. All right, these are stories that we need to hear. They're stories of people who have recovered. Those that have had this and have gone through the worst of it will tell you that for some people, it can be really hard to beat. This is Mary, who's 76, who is coming home. It's a special day. We want a lot more of these. And as we move forward and as we talk about our plans for the future, we want to make sure that this is always possible. That until we have a vaccine, we make sure that we have the capabilities to try to get these outcomes. Mary, we are really happy for you. All right, I like this one. This is our opportunity for our kids to get outside. Remember, being healthy at home doesn't mean you're cooped up. It means you can't be around other people, but you can certainly get the physical exercise you need, get into nature, and let's remember both the parents of small kids and to small kids and older kids. This is a traumatic time. It is for all of us, and folks, it is for me. And so it's okay to talk to people about it. It's okay to seek any help that you need to. None of us have ever been through this type of anxiety, so make sure that you are taking those moments and you're spending time with the family. Look at that smile. I mean, we got to make sure that we truly grasp the joy that is out there in these moments in our lives. All right, and I think we have one video as well.
All right, here we go.
You have seen video of folks who have gotten through this. And when I say we'll get through this together, they're getting through this because of our heroes, our healthcare providers, those that do everything they can, knowing that these patients had COVID-19, the coronavirus, and they showed up and they helped them, and because of their amazing work, because they had the PPE they needed, because we have made sure that we have flattened that curve so that there are the beds, the ICUs, and the rest that people need. We get moments like this when folks get to come home. So I wanted to do a little bit of hope for us today because we are going to get through this, right? And we get through it together. All right, so we're going to learn a little more sign language today, but Virginia continues to educate me about the appropriate etiquette. So we're not going to switch places now, but I'm going to ask today, Virginia, if you will, teach us how to say thank you so we can say it to those healthcare providers. Thank you. Thank you. All right, one more time. Thank you. I will tell you that because what we're going through is hard, while there are critics, I think all of us learning something new and how to include people, to making sure that everybody out there matters, everybody. and by showing the type of behavior and joy and we need to see. I really think it's one of the most important things we do every day, and I think it's one of the reasons that we have flattened the curve the way that we have, that we have not just committed to do what it takes to beat COVID-19, we've embraced it. We've put it out there for the rest of the world, and we've shown our friends and our neighbors that we are committed, which makes them being more willing to be committed. All right, we've got some good announcements today. First, and this was reported a little bit earlier today, we have expanded our partnerships with other states on how we jointly work to reopen our economy. Yesterday, we had announced a group that we had previously been working with, which was Ohio and Indiana. But today, we added Michigan, Wisconsin, Minnesota, and Illinois to that working group. What this makes sure is that these Midwestern economies and many of our bordering states, that we are all in very significant coordination to help us not only make sure that we don't have an additional later spike, but also that one state's contacts don't come into another, something we've been trying to prevent for a while now, and that we are discussing best practices. And while it will be ultimately the decision of each individual state in the steps they take, this is going to help us, both on the public health side and making sure that while it will be a phased-in approach at opening up our economy, we do it in a way to where we can have that symbiotic bump or charge to make sure that the steps that we take ultimately have a bigger reward or bigger output because they are being replicated in other areas that we already do so much business with. So this is really significant. This is making sure that we are working with our neighbors, doing the right thing by our neighbors. While I always say we're in this together as Kentucky, we're now in this with some other states to make sure that we are working together in our steps to phase in different parts of our economy. All right, testing. We're going to talk a lot about testing today. While we still need significant increased capacity, and we're going to talk about that tomorrow when we talk about the different standards we're going to use about timing on our economy. And tomorrow, I'm going to walk through what the president's going to put out at 6 today about his plan, because a lot of benchmarking guidelines that are in that determine for them as guidelines the when and the how. And what we'll find out tomorrow and after he's made those announcements is a lot of them are the guidelines that we're thinking about and we would have been talking about tomorrow as well. But we know that we have to have more testing in Kentucky, both right now as we are dealing with our surge, but also as we want to eventually step out of this. It's going to take significant amounts of testing and then contact tracing. So our update today is our Frankfurt facility and our partnership with Kroger. Remember, Kroger in this partnership, and they're here today, and I'm going to ask them to come up in a minute, have donated. It's pretty special. The personnel and the PPE, and the state is contracted for the lab testing and the shipping. And what it gives us is an ability within 48 hours to turn around those tests and to help our people get tested and know if they have this virus and take the next steps. So we had our best day yet in both of our locations that are open today. In Frankfurt, we tested 202 individuals, at least as of the time I was walking out. And in Kenton County, we tested 227. I want to thank all those local leaders. The Frankfurt leaders have already been working it. Kenton County leaders, I think along with the state, are filling up that site each and every day. That's a real positive. It's going to help that community. So thank you to the county judge and everybody else who's working with us. So today, we are announcing 4 sites next week that will operate Tuesday, Wednesday, and Thursday. and I'll let our Kroger representative tell you the hours because I know that they have expanded. Our goal is to do 1,000 tests over those 3 days in each of these communities. And in every city or county where there is I'm going to be reading cities, where there's a testing site, it is open to all the contiguous counties or even the region in Kentucky. So we want to make sure that we really push people to sign up and go ahead and start signing up as we end today, going up to Tuesday. So the 4 sites are first, Madisonville. My parents are from Hopkins County. My grandparents are buried in Hopkins County. The area's been hit really hard, and I wanted to make sure one of the very first sites that we got was in Madisonville and in Hopkins County. Now that's going to be able to serve Christian County as well, which has also been hit, but we have a separate set of tests going out to the Christian County Public Health Department. So Madisonville is site number 1. Paducah is site number 2. And our hope is that means we can get a significant amount of Western Kentucky, though we will have an additional Western Kentucky site likely the next week. Third site is Somerset. And the 4th site is Pikeville. And so our goal here, given how we've been pushing out other tests, is to make sure that we have a testing presence all over the state. And to talk a little bit more about that today, we have Megan Brown, who is with Kroger, is the National Health and Wellness TLC Director of Kroger Health and the Little Clinic. Megan.
Thank you, Governor Beshear, Dr. Stack, and Director Dossett for your continued support and partnership with the Commonwealth of Kentucky. We are excited to announce that beginning Tuesday the 21st through the 24th, Kroger Health will be offering 4 testing locations. We did partner with the state to choose these locations to better serve our community and help people live healthier lives. Again, we will be in Madisonville, Paducah, Somerset, and Pikeville. We will continue to operate these 4 locations for 3 days. We will continue to operate from 8:30 to 5:30. We have changed the hours based on the feedback from the Commonwealth and wanting to extend those hours each day. We anticipate that we will test up to 330 patients per day per location. We will do this by meeting the certain criteria produced by the CDC, and that is priority 1, 2, and 3. The drive-through testing locations will feature a self-administered nasal swab that must be ordered and observed by a provider, so we will have nurse practitioners on site at each location. Kroger has determined that this testing methodology is beneficial as it increases the number of tests that can be performed, as well as conserving the amount of personal protective equipment that is utilized. So as you can see on the screen here, we're going through priority 1, 2, and 3. Each week, we are partnering again with Governor Beshear and his team at sites and additional testing locations that we will operate. Kroger is committed to expanding these drive-through testing facilities and other locations to provide the vital needs to increase the health wellness directly of the Commonwealth, which allows us to achieve our mission at Kroger Health to simplify healthcare by creating solutions that combine health, wellness, and nutrition and connecting with people on an emotional and personal level. So again, if you would like to be tested, the scheduling sites will be open. You can go to krogerhealth.com/COVID testing. Again, if you would like to schedule in Madisonville, Paducah, Somerset, or Pikeville, please visit us at krogerhealth.com/COVID testing. Thank you, Governor Beshear.
Thank you. I can't tell you how important this and our next partnership have been for the state, and I want to thank Kroger for sticking with us. It's been a long road to get here. They never gave up, and neither did we. And between what they are donating and then our contracts with Gravity and UPS, this is very helpful, and it's making sure that we can serve all parts of the state. We're One Kentucky, we're Team Kentucky, and we're making sure now that we can test in all of Kentucky. So again, we still have some days left through Saturday in Kenton County, though I know there have been a large number of signups. Let's make sure we maximize it. And let's go ahead and start getting Madisonville, Paducah, Somerset, and Pikeville, and all the surrounding areas. We want to try to hit 250 a day. No more, 333 or 34 one day, a day, each of the 3 days that they are going to be open. Let's not leave one test unused. Let's make sure that everybody who falls in those testing criteria get tested. This is exciting, as we're able to build up our capacity. Now, what we will expect to see are more cases, and we ought to be ready for that. We know they're out there. But as we build up this capacity, it's certainly going to help us as we move into what the new normal will be, certainly in this country, until we get a vaccine. Next, I want to ask Dr. Stack to come up. He is going to introduce our partners from Gravity Diagnostics. I'm going to steal a little bit of his thunder, because I always do, and just say that we couldn't be where we are without Gravity. They are not only helping us in our Kroger partnership, but they are helping us with almost 2,000 kits a day, or that capacity, at hospitals all across Kentucky. This is a Kentucky company that has stepped up at our time of need, and we're going to ask them to continue stepping up. They've had a whole lot of capacity that we bought up, but we're going to look for a whole lot more, again, as we try to get to that new normal. So Dr. Stack's first going to talk about them and introduce them, and then he's going to step us through some of the different types of PPE, because we know we've been talking about them, and they're going to be just as important in the future, and he's going to show you some of them so at home you really have a good idea of what we're talking about. Steve?
Thank you, Governor. You can have all my thunder at some day. I'll look forward to the day that I don't have to be here every day in front of the media. So, but thank you very much for the opportunity. I'm going to get a chance to talk about a few things today. I told you last week we started a partnership with Gravity Diagnostic Labs, which is in northern Kentucky. We couldn't be happier with the partnership we've had. In just a minute, I'm going to introduce you to the CEO, and also his co-founder, the Chief Operating Officer, are here today with us. They have done wonderful and heroic work with us. They first supported us with providing a capacity of 2,000 test kits a day that we are continuing to work to get out as much as we can across the state. And then when the Kroger testing site plan was able to move forward, they provided testing capacity to support that program as well. And so Gravity has a very integrated program with UPS, with the Kentucky Department of Public Health, now with the Kroger test sites, and then also with our partner hospitals and now local health departments across the state. So today we have Tony Remington, who is the CEO, who I'll have you come up here now, Tony, to say a few words. And then his co-founder and partner, Julie Brazil, is also here, and she's the COO. So come on up, Tony. Thank you.
Thank you very much for having us here today. I've never been able to say anything in 60 seconds, so I'll just say I'm extremely humbled and honored to be a part of the solution that's facing all of us across the country, especially in Kentucky. I've been amazingly impressed with the way the private sector and the government have come together at the city, county, state, and federal level. It's been just an honor to be a part of the solution, and I kind of feel for the people that are homeschooling their kids and kind of can't be part of the solution. So I feel like we're honored to have this opportunity to help get the nation back on track and get Kentucky back on track. I just want to say the Gravity employees have been absolutely amazing. When this happened 4 weeks ago, when it really started to hit Kentucky, we didn't have one employee turn their back on this problem. We have people that haven't seen their kids in 5 weeks. We have people working 6 days a week. We started working at 6:30 and creating 2 shifts till 8:30 at night to accommodate the capacity required in Kentucky. And so the team has just been amazing. We've hired over, I think, 17 people now, so we're up over 55 people in Covington, Kentucky, and then about 140 people nationwide. So Dr. Stack's been amazing. I mean, the governor's been phenomenal. Kroger has been great. The community we're in, people have given us gloves and gowns and set up Connect, just it's been awesome. I mean, so I'm really proud to be a part of it, and I look forward to seeing this volume grow every day moving forward. So thanks for having me.
All right. right, I got some show and tell here for you today, and I'm going to also say that Tony and Gravity Labs donated 10,000 lab gowns and also 200 N95 masks. And so thank you very much for that, Tony. We appreciate it. If you could show my slide, James. So I'd like to, the first thing I'll do for show and tell is I want to show you when folks get particularly hard hit by the coronavirus, they can have severe trouble breathing. And this is one of our concerns, right? We've talked about ventilators and needing enough ventilators. So in order to put a breathing tube in, I'm an emergency physician, I've said that. So in order to put a breathing tube in, normally we have a mask or a face shield and a gown, but we have to have heightened protection because this infection spreads so easily. So I don't know where it first started, but I saw it in social media groups with emergency physicians. People around the country started making these plexiglass boxes. So I've got one of them here. So this plexiglass box, if a patient is having respiratory difficulty and has to have a breathing tube put in, you can put it over the head of the patient, and then the physician who's having to do the breathing tube procedure can reach in through the hole and do this. And what it does is it minimizes the physician's exposure to the secretions of the patient. When you put the tube in and you start to use it to ventilate a patient or use the bag, you aerosolize, or you take the liquid that's in their respiratory system and you kind of put it up in the air. And this shield helps to minimize the exposure to the doctor doing the procedure. So Norton Healthcare worked with First Build, which is a subsidiary of General Electric, and together they worked with the people at Norton. They decided what the specs should be. They started with a heavier plastic and made it a lighter one. And now First Build, whose executive director is Larry Portaro, has built 500 of these. And they'll have the 500th of them finished, we believe, tomorrow, and have donated these to the state of Kentucky. And we will start distributing those. So for all the hospitals I haven't talked to on the call today, you should expect these to start showing up at your hospitals to use for your ICUs and emergency departments. So thank you very much to First Build and to GE. GE also donated other personal protective equipment to the state, which is now part of our inventory for distribution. So thank you very much to GE and to First Build. Now my show and tell for some other things real quickly here. We talk a lot about test kits. When you see it this way, it does not look particularly fancy, I will tell you, which is no small part of the consternation for why it's so hard to get this stuff. But a test kit is really not much more than a little vial, which is in here, which has some viral media. So when you put the sample in here, that keeps the virus in a condition so that we can test it, but inactivates it so that it's not spreading the infection. And then we also have a swab. Now I took one of these swabs out, and if you were to feel the swab here, it's kind of like one of those cat's tails that's next to a river. It's called flocked, but it feels real fluffy. And it's made of a synthetic material that when it gets exposed, it absorbs and catches the cells so that when you put it into the viral media, there's enough sample size in there to hopefully provide a good result. And then we use that on a test called a polymerase chain reaction, or a PCR test, where they take the fragments of the virus, amplify it, and then they're able to find it with the testing machine. So that's what a test kit looks like, and you can understand why we're very frustrated. It shouldn't be that hard to get a swab like this, but apparently it is incredibly hard to get a swab like this. And the only other things I'm going to show you today, this is a now gold standard 3M N95 mask. So this mask, and I didn't do a very good job yesterday explaining this, it's like the filter in your air conditioner, but it filters 95% of the particles in the air we breathe. So it has a filtration size so small that it literally filters microscopic material so that you don't breathe it in. And when you put it on your face like this, you have to have it fit tested because it makes an airtight seal around its edges so that you are forced to breathe all your air in and out through this. It filters it so well that it actually decreases the concentration of oxygen that you inhale. And so if you breathe with this thing for hours at a time, it can really be quite unpleasant. So these are the things we need to keep people safe when they use boxes like this and put breathing tubes in, or when they're in the ICU, because the risk is so high. This is at least one form of what we call a KN95. So there's different standards for these masks. This is supposed to filter 95% of the particulate matter, but it is not like the 3M one. And what we find with some of these is the fit on the side of your face is not as good. so it doesn't form a complete seal. But these are the kind of things we've been working so hard to obtain so we can keep our healthcare workers safe while they do this great work, taking care of patients, your loved ones, and our fellow citizens. So, Governor, thank you for the opportunity to show these things. And
We've had a lot of our Kentucky companies step up and help us with what we need. I will say that GE Appliance Park on a call with me basically just said, how many do you need? And we'll make them. When Dr. Stack came back and said, how about we start with 500? I wasn't sure how the response would be, but they said that they would get it done. And along with all the other donations, we talked about PPE donations, are going to help a lot of people. A quick announcement on parks. In partnership with the Department of Public Health, local health department, our Department of Parks and Park Ranger Law Enforcement, Fish and Wildlife, our Kentucky National Guard, and volunteer medical staff, we're going to have non-congregate sheltering for persons needing isolation to prevent the spread of the coronavirus. It's going to be by referral only through collaboration between public health and clinicians. We're going to start at Lake Barkley and Lake Cumberland that will be active beginning Sunday, April 19th, and we're going to have others that are going to be used as needed. It's going to be a place where people who can't safely go home if they're either sick or they think they've been exposed to be. Patients and guests staying at the center will be very low acuity and are expected to be able to provide for themselves or self-care. So these are the cases where we don't want somebody spreading it, or we think it's a probable case, but the person is in that state where they're likely going to be okay, and if they can be checked on, it's not going to be pleasant, but they're going to get through it. Because it's important for people who are sick or exposed to COVID-19 to stay away from others. But sometimes people don't have a home or a home where they can be isolated from others. And this provides an opportunity for someone to have a place to go to make sure that we are not spreading the virus. These states are also going to relieve pressure on hospitals because right now the hospitals get a lot of the people that don't have a suitable home or place to self-quarantine, and our parks are going to provide a good opportunity to make that happen. The center is going to have a limited medical staff. They'll be there for monitoring and emergencies. Basic first aid and limited medical care will be provided, but these are not places where we're going to put those that are very sick and need significant care and significant monitoring. We're going to provide 3 meals a day, TV, Wi-Fi, and it's at a secure location with security provided to make sure that everybody is safe. Again, I mentioned it in the beginning. I know at 6 o'clock the president is going to outline his new plan on the coronavirus. They gave us a preview as governors, but I believe he ought to be able to present it. I am going to go over it tomorrow, first reading through it. There's a lot of things in there that we're looking at as well. And I just ask that everybody, as it is announced, look not just or don't just listen to different dates, but actually look at what the benchmarks are for when they recommend, because it is just a recommendation that states take certain steps. So tomorrow we'll go over that. Haven't had the time to absorb it as well. We'll go over our additional metrics to opening up. So by the end of tomorrow, you'll have not only who we're working with on reopening the economy, but you're also going to have the metrics we're looking at. You're going to have our analysis of the president's plan and even maybe where we are on some of those metrics and what we would need to hit in the president's plan to do certain things. In everybody's plan, reopening is gradual. It is by phases. And the new normal is going to be different than our old normal. We're going to be able to start coming out of this in ways that I know all of us have wanted to. But let's remember that until there's a vaccine, we're still going to be doing some things very, very differently. And even in a phased approach, our seniors, the vulnerable populations, are still going to be very, very at risk for this virus. And just because we're going to be talking about those plans, and just because we're even going to be talking about what we might think on dates. Tomorrow, remember, we believe we are still on our upward trajectory. So let's make sure that even though we're talking about things like this, that we're not at halftime at a very close game talking about our game plan for the next day. Beating the coronavirus, staying focused is how we save lives. All right, let's look at our numbers for today. Today, we are reporting 159 new cases of the coronavirus. After we remove duplicates and others from out of state, our new count is 2,429. Now, that's lower than we've had some other days, and I know yesterday we had a lower amount, but we believe tomorrow is going to be one of the highest numbers we've seen, and part of that is bringing in some data that's had to move through a couple of systems that will hit tomorrow. I believe on top of the cases that we have tomorrow, there'll be 200 of these. So let's expect we'll have a big day tomorrow, but what we really need to look at are the averages over those days. And as we look at what I believe will be a 3-day average, I think we're still going to see that we are doing very well, that your work and your commitment has flattened the curve, but we're still dealing with a lot of cases of the coronavirus out there that is a very deadly disease that spreads very, very quickly. Total number, and some hard news today. One of our new cases is a 10-month-old baby in Lincoln County. So let's think about everybody that's a part of these numbers today. Let's think a whole lot about that little kiddo. Let's think a whole lot. As the dad of 2 kids and one that was born in some distress, I remember I didn't breathe for about 2 minutes. Let's make sure we're sending all of our prayers and all of our thoughts to that baby, the family, and let's make sure we lift them up in every way that we can. Our new cases by county: 20 in Jefferson, 18 in Warren, 17 in Davis, 11 in Jackson, 7 in Muhlenberg, 6 in Boone, Graves, and Henderson, 5 in Fayette, 4 in Greenup, Hancock, Kenton, and Russell, 3 in Bourbon, Boyd, Callaway, Floyd, McCracken, Ohio, and Woodford counties, 2 in Butler, Knox, Pendleton, Pulaski, Simpson, and 1 in Anderson, Ballard, Barron, Bracken, Campbell, Garrett, Grayson, Hardin, Jessamine, Lincoln, Martin, McLean, Montgomery, Nelson, Oldham, Rockcastle, Union, Wayne, and Webster. And we've got 3 that we still need to replace. So remember, it's everywhere. Just because you don't have a confirmed case in your county, and we got to be down to just a handful, doesn't mean that it's not in your county. That's why we are all making the sacrifices we are, and because everybody out there is treating it like it is in their county. That's why we are flattening the curve and how you are protecting people. And let me say to all of our local leaders out there, all of our county judges and our mayors and our magistrates, thank you. Thank you. Your aggressive action. You know, sometimes people talk about my aggressive action, but your aggressive action has saved lives. And when we are through this, we know we'll have saved thousands upon thousands of lives based on your leadership and the sacrifice of all of our people. Total number tested that we can confirm right now, 29,747. We're getting very close to that 30,000 mark. These numbers are going to crank up as we have our 4 sites that open, as we have more of Gravity's hospital tests that are out there. So we will see an escalation in the total number of tested, which means we'll see some more positives. And remember, as we get testing sites up in various locations, we'll see more positives from those areas because we'll have more testing. It's what we expect, and we'll know to be prepared for it. We'll be able to breathe and know that it doesn't suggest that anything is different in our county, just that we're having more information in our county. Number of Kentuckians that have ever been hospitalized because of this virus, 971. Currently, 477. One of the bright notes to come out of this is how well our hospitals have done stabilizing people and getting them out early. And it's one of the things that make us feel much better about our ability, healthcare capacity to handle a spike. It's not just our ability to ramp up beds, which we were focused on. It's how well the systems are doing in stabilizing people and getting them out. We've had 506 Kentuckians ever in the ICU, currently 333. They call it intensive care for a reason. So let's think about these individuals. And we have had 956 Kentuckians recover out of those 2,429. That is really exciting. We're thinking about all those folks too. Today, we are also confirming an additional 7 deaths due to COVID-19. These 7 individuals are Kentuckians. They're one of us. And their loss, the loss to their families, is a loss to all of us. So let's not let up on lighting our porch lights green, our facilities. Let's not stop ringing those bells at 10 a.m. every day. These families are going to be going through mourning. They're not going to be able to have traditional funerals. So let's remember that they need us now more than ever. And as these losses are cumulative, we know that there's so many Kentuckians out there that are hurting. And with the ICU, so many that are worried. So let's remember that our number one priority is protecting people. It's protecting these people. It's making sure that we don't have more loss than we have to sustain. This is our mission. This is our calling. I know that we are up for it. Deaths by county. I only have the overall. Here it is. New ones. 79-year-old male from Jefferson, 85-year-old male from Jackson, 68-year-old female from Jefferson, 78-year-old female from Adair, 69-year-old female from Shelby, 67-year-old female from Graves, and a 92-year-old female from Jefferson. Ethnicity and race. On all cases, we know the race of about 75% of them. And so within that amount, 80.12% white, 11.75% black or African American, 3.08% Asian, right around 5% multiracial. Ethnicity, we know 67.63% of known cases, 97.28% non-Hispanic, 6.72% Hispanic. Deaths, again, we see what happens with hundreds of years of inequality and certainly unequal access to health care. We know 81.39% of deaths, the racial data, 78.1% white, 20.95% black or African American, about 1% Asian, and on ethnicity, 99% non-Hispanic and 1% Hispanic. We are working on efforts that will include testing, not this next week, but I'm hoping the week after, specifically in our African American communities in our 2 largest cities. We need to make sure that we are directing resources where people are being hit the hardest, and I want our African American communities to know that we're committed, that while we can't immediately erase the wrongs of the past, we can do the best we can to do the right thing in the present and then moving into the future. I hope out of this that we take the calling, the requirement to finally end some of these injustices. And let me just again remind folks that tomorrow is going to be a tough day on the positives. So we expect tomorrow, again, it's just because some of our accounting, it won't mean that the particular day was the toughest, but tomorrow we'll expect to have our largest number of cases, which we'll look at averaging the last couple days. Okay, let's go through the 3 areas that we've talked about, and then we'll open it up for questions to try to do this in an hour flat. Western State Hospital, 5 new cases. All 5 of them staff. Remember, we tested about 130-ish staff to make sure that we had staff helping patients that wouldn't be transferring the virus. I don't think all of those tests are back, but this is a number that wasn't just expected, but may even be promising given the number of tests. Green River Facility, Correctional Complex, we have 2 more cases, 1 inmate and 1 staff member. Again, we're working very hard within that institution. You can see a lot of the steps that we are taking here. I know the folks inside that institution are scared. This is a scary, scary virus. We're going to do everything we can, and that's masks, that's sanitizer, that's making sure that we have different parts of the facility for those that are symptomatic or that we know have the virus. And then in our long-term care facilities where we're getting hit the hardest, we have 27 new residents and 11 staff that have tested positive and 1 additional death. This is where Dr. Stack is spending the vast majority of his time and any plans in the future about how we're able to change things, and as we talk through them, how we're able to start opening up. We have to make sure that we protect our folks in our long-term care facilities. So I will say that visitation in these facilities is going to be shut down for a while because the virus is going to be with us for a while. Even when we're taking the appropriate steps that we believe will be safe for the general public, they're not going to be safe for our most vulnerable population. So for this, we're going to have to dig in, and we're going to have to do everything it takes to protect especially this population. All right, so questions today. We have JoJo, Phil, and Karen, and then I have some questions here, and we'll start with Karen.
This is for Dr. Stack. The saliva test that the FDA just cleared. What are you hearing so far? Is it something you want to add into our supply chain, or are you more comfortable with the swab test, or is it just too early to tell?
Okay. Social distancing.
Yeah, I know. So thank you. So the saliva test. So this infection is a respiratory infection, and it's in your nasal secretions, probably in your saliva. So it's just a matter of where you get the sample from. So the best sample, the gold standard sample for most of them, is the deep back of your nose. The only thing better would be to go into your lungs, but that's a bronchoscopy. The saliva has it, and if you have symptoms, we think it's pretty good. And in fact, we're working on our own study to validate that approach ourselves. So if we prove that it can work, we'd be happy to use that. Then we don't have to swab you, you can spit. But if we're going to do that, you really have to have active symptoms for it probably to be the most reliable. So we're hopeful, and maybe that will be an avenue.
All right. I misspoke earlier, and I got to make bad news worse. It's not a 10-month-old baby. It's a 10-day-old baby. So let's continue to send our thoughts and prayers out. I mean, this is a family that just had a miracle occur, and now are probably living through a nightmare. So everything that we can do, let's make sure that we do. How many Kentuckians' coronavirus-related deaths were where people did not have underlying health conditions? Well, I know we can confirm 1, and that's out of Boyd County. Our healthcare worker from Adair County really had 1 comorbidity. Most everybody we're seeing passing away have some pretty significant underlying health conditions. But what we're seeing is that's not a requirement for this disease to end your life. And that's why it's so important that we continue to practice social distancing and realize that we are all responsible for everyone else around us. Joe 1, and then Joe 2.
So back to the regional partnership, Governor DeWine of Ohio said that his businesses will start opening in his state May 1st. Does that mean that Kentucky will also start opening business on May 1st?
So Mike DeWine today had said that he thought he'd see some gradual reopening starting on May 1st. I don't think he listed exactly what will start, and a lot of it's going to be guided by some of the things that we're going to talk about tomorrow. We're going to be looking at a number of different areas, some of which may hit May 1st, some of which may be a little further. When we put up the metrics that the White House is suggesting, we still have a little ways to go to hit some of them, and their metrics they suggest before you do anything. But there are some areas, especially in healthcare, that provided we can have certain amounts of PPE that we think could potentially open up around that time, maybe a little bit earlier. One thing we're really concerned about is that when we're seeing people in the ER right now for non-COVID related issues, they're sicker because we're not having people go into their doctors right now. And that was necessary to make sure that we flatten the curve. But we're going to be looking at some opportunity there. Others are going to be limited by the amount of PPE, the amount of testing we have, and some other criteria that we'll talk about. And it's all going to be dependent on that. But my hope is, if not May 1st, and May 1st is a hard date to hit, that we'll be able to see some, and it's really gradual and phased in every plan we see out there. Late May or June, we hope that there are certainly some things that Kentuckians will be able to be doing again. But again, there's no old normal. There's only going to be new normal until we have a vaccine, and there's going to be some risk in doing it, and we're going to do the best we can in balancing that risk with also steps we got to make to ensure that we can begin to open up the economy. Green River Correctional Complex, examples of how inmates are being protected through the crisis. Are they provided masks, and how often are they sterilized? So our understanding, and this is from our Justice Cabinet, is that everybody has been offered and provided a mask. I don't have the answer on the sterilization, but the masks, one of which we have actually over here, are made by inmates in our correctional center. James, can you pull up the Green River slide? There is also a staggered recreational time, limited number of inmates released for social distancing. The cleaning of high-touch surface areas is being done extensively. They've closed off certain areas that people would go to where you could not social distance. And there is a very strong effort on the medical side as well. What would you have to see from a state like Tennessee to develop a partnership like the one you formed with governors of Ohio and Indiana? To my knowledge, Tennessee hadn't reached out to us. I guess, given some of my comments, I could understand that, but hasn't reached out to any of the rest of our partners either. And we just had different approaches in how we went into it. Now, ours was very similar to Ohio's and pretty similar to Indiana's, and that just made us very natural partners. I've also got a long-standing relationship with Mike DeWine. We were attorney generals together fighting the drug epidemic, and that led us to a natural partnership here. All right, Joe 2.
In regards to the president's call that you had talked about this, I know you're talking about more specifics tomorrow, but in a general sense, just what was your overall take on how the White House is kind of preparing the reopening of the economy?
The question is on the White House call we had. What's my opinion of the president's plan? We're still working through it. What I have right now is a high-level summary, and while he needs to be able to announce it, and he's doing it here in just a few minutes, the first thing that struck me are the initial metrics, not just based on a date, but the initial metrics that a state should hit. The different things that it should have to be able to do things safely. And what we'll talk through tomorrow is there a lot of the things that we were thinking about and what will guide our decisions. And that has a whole lot to do with the virus, right? And what's going on with the virus and what's going on with the virus here and what the numbers are. And that'll be one of the major guides in how we do it. But we'll be able to talk about what we'll be looking for tomorrow so people can watch the numbers and say not only what that means for the families that are going through it, but what that means on where we are in the path. I know people want to be able to see that and kind of have an idea for themselves. So hopefully we lay out these metrics, gives people a lot more security. Number one, we're going to do things safely. And number two, what exactly will guide us on the when and the how. Senate Bill 9, the Infant Born Alive bill, was passed last night with the contents of House Bill 451 attached, giving the AG new enforcement authority over abortion clinics. I haven't read it. I don't have any decision on it yet. I've been working solely on the coronavirus. I will look at it at some point within the period of time that I have for vetoes. Phil.
looks quite a bit different outside after what happened yesterday. Can you talk a little bit about some of the changes, and understand also there's, as far as what protests are going to be, there's going to be some changes on how people are to protest if there is going to be another protest.
So the questions are differences between today and yesterday, given the noise we heard outside yesterday. I'm going to ask Dr. Stack to first talk about or in a minute talk about the health aspects of the mass gathering we had yesterday, where people weren't social distanced at all. People have a right to support or to protest, but during the coronavirus, they've got to do it in a way that doesn't spread the virus. I think we can all agree on that, because it's not just the people that showed up and may have violated social distancing. It's who they come into contact with and who that kills. And we want to make sure that people have the right to voice their opinion, but in the middle of a pandemic, to do it safely. The only thing that we've done here in the room differently is we're working on soundproofing. I understand a couple of dozen people wanted to drown us out yesterday, but I think that there are a whole lot of people at home, a whole lot of people out there that wanted the information we were providing yesterday. And for the families that we had to announce the loss of their loved one, screaming to drown that out isn't right. It's just not right. And so we need to make sure that people at home can get that information, and that we can convey it in a way that shows support and sympathy for those we've lost. Dr. Stack.
I've made no secret as I've come up here and spoken that I've studied Latin and Greek, and I read presidential history books because I really enjoy our country and our history. And I want you to know, and I said this past Sunday, on Easter Sunday, I made a remark about this is a really difficult tension between people's rights to gather and people's right to not be hurt. And it's tough. But the mass gathering that happened yesterday is exactly the kind of mass gathering that we have public health orders that say are prohibited right now, because we have proven, it's been proven here, it's been proven elsewhere, that when people come together like that, because the virus is so incredibly contagious, one person can infect multiple people who then take the virus somewhere else and infect other people. So that's both, if you remember from a few weeks ago, the buckshot and the honeybee problem. They all come together, and when they scatter, that's buckshot. And then when those individuals go from place to place, that's the honeybee pollinating coronavirus all over the place. So what happened yesterday, I don't offer a comment on people's right, other than to be supportive of people's right to have different opinions. I mean, I cherish that. I cherish our democracy as much as anyone else does. It's just a difficult tension, because our right to express ourselves should not expose others to danger that we know can lead to death. And I don't have an answer for you, but from a public health standpoint, we have to find a way to protect the rights that are so important for our right to express ourselves while not exposing others to risks that they shouldn't have to accept. And so we'll keep doing the best we can.
All right, we're going to try to take one more question from everybody. I've been asked by a number to get us out in exactly an hour, so I will give the shortest answer possible. I do have one question here. Do I plan to sign Senate Bill 158? I haven't seen it on my desk yet, and so we'll have to review it. All right.
Quick follow-up to Bill. If people do, which there's an 11 o'clock plan tomorrow, if they are not social distancing, what will be the legal ramifications?
Well, our goal by tomorrow is to set up a method where people can safely and per social distancing be able to express their opinion here at the Capitol. One model we're looking at is kind of the drive-in model that people have been able to use for other methods. And again, as long as people would be within their car in a confined area, a certain amount apart, there's an opportunity there for people to be able to voice concerns or support. Joe.
Back to the regional partnership. The metrics and the factors that the states are looking at whether to reopen their economies, are they the number of cases and hospital admissions in the state, the amount of hospital capacity, the ability to test and trace cases of COVID and best practices for social distancing among businesses?
Those are metrics that those states are looking at. They were metrics that independently we're looking at, and we will discuss tomorrow. And I think you'll see those metrics in somebody else's announcement here in a little bit. Joe?
In regards to what lawmakers did yesterday, I know you talked a little bit about some of the other bills, but 10 of the 11 education board appointments were approved, all except for David Karam. Just what's your kind of reaction to that?
So the question is 10 of 11 of my education board appointments were approved, with the exception of David Karam. Let me first say I've got a lot of respect for what Senate President Stivers did. He had objections to how I put together the board, and yet with the coronavirus out there, had said even though that these were his concerns, now was not the time. And I think it's because of that most of those appointments went through. And I thank him for that. That's going to create stability in finding a new education commissioner and helping to guide us through the next year. Even with any of the goofy stuff that's happened in the last couple of days, that was the right gesture. Now, I will say I am disappointed that David Karam is not on the board. He has been a past board chairman. He can run a meeting within the Open Records and Open Meetings law, which I know is important to those that are here. He led the charge on CARA. He has sacrificed and given so much to this Commonwealth. He will be really missed on that board, but at a time when we really needed him, he stepped up as chairman and did some really important work. Just another example of David Karam serving his state in a really honorable way. All right, last one, Phil.
And then back to this, what I asked before, there's obviously a large police presence here as well. Anything we should read into that, or see, I mean, as far as the number of state troopers we see outside and things of this nature, have there been anything else that's happened? As far as
No, nothing else has happened. Just ensuring that we don't have situations that spread the coronavirus. Just making sure that everybody has an opportunity to express their opinion, but in a safe manner and in a similar way to where we're asking everybody else to avoid mass gatherings, but still engage in various activity in the age of the coronavirus. All right, we are exactly at an hour. We are going to get through this. We're going to get through it together. Keep it up. Stay strong. We are all getting antsy. We are all getting antsy, but you're winning. We are winning. You are flattening the curve. You are saving lives. You are doing this better than just about anybody else out there. And it's because we have all come together, not Democrats, not Republicans, just Americans versus this coronavirus. This is the challenge of our time. This is a test of our humanity. This is what the history books will write about. Let's make sure that when our story is written, it's that we loved one another, we cared about one another, and we saved each other's lives. See you tomorrow at 5.